Hi, this is Dr. Nidhi Rawal, and welcome to our next series on National Eating Disorders Week. So, as we are learning about feeding difficulties in children, it is also important to know what are normal behaviors when you start introducing solids to your baby. So, a lot of parents feel scared and afraid to start solids because they are worried that the child would gag. And what happens? The child does gag. So it's completely normal for a baby to start gagging when you first introduce solids. The answer is to continue to expose them to a small portion of solids regularly so that they start to learn how to swallow and chew the solids. Some of the other things that we commonly see in children and is completely normal. So these are fluctuating appetites. Younger babies, older children, even up to 10 to 12 years of age, these children can have appetites that fluctuate. Some days they will be very hungry and some days they would barely eat. As long as this is not consistently happening, that they're missing their meals, it's okay for them to miss a meal. The other big one is messy eating. When you start introducing solids for your babies, it is very commonly seen that they would first make a mess out of it. It's just how they explore. So respect that. Let them play, let them explore. Seeing the food, touching the food, smelling the food is their way of exploring the food. Once they are comfortable with that texture, with that smell, and with how the food feels in their hands, it is much easier for them to actually accept those foods while eating. So these are completely normal behaviors that we see in children. And as long as it does not completely exclude certain food groups, it's completely okay to respect that behavior and go forward with certain preferences.